What we can do is okay. Good afternoon, everyone. Welcome to the Senate Business Professions and Economic Development Committee hearing for Monday, July 13th. We have one bill for consideration today, AB 1306. So let's call the roll, please, to establish a quorum.
Hill?
Here.
Hill here. Bates? Here. Bates here. Berryhill? Berryhill here. Block? Galgiani? Hernandez? Here. Hernandez here. Jackson? Mendoza? Wachowski? Here. Wachowski here.
Did you call the Assembly member's office, please? Assemblymember Burke, welcome. You are the one item today we have.
I am, and thank you so much, Mr. Chair.
Press the, oh, there you go, you're on. Please proceed. This is AB 1306.
Yes, sir. Thank you, Mr. Chair and Senators. AB 1306 allowed certified nurse midwives to manage a range of primary health care services for women within their existing scope of practice. This bill untethers them from physician supervision to continue to provide the same services that they've been providing for decades. I think that we can all agree that certified nurse midwives should be able to practice to the full extent of their education and training, and that's really what this bill is about. We have nearly 1,200 certified nurse midwives practicing in California, and while most other states allow certified nurse midwives to practice independently, we're one of only 6 states that require physician supervision. It may surprise you to learn that many of the counties that you all represent either have a shortage of OBGYNs or simply no practicing OBGYNs at all. Certified nurse midwives can fill the gap in women's health care in your districts and communities across the state. Unfortunately, instead of talking about improving access to care for Californian women and the practice of midwifery in hospitals, clinics, birth centers, and homes, there are those who are focused on the corporate practice of medicine ban in California. And this bill has become one more pawn in the fight between hospitals and physicians. Never mind that the current language in this bill includes broader exemptions than those in place for physicians. In fact, with this bill as written, about 1% of certified nurse midwives practicing today could see a change in their employment status. Even the California Hospital Association estimate is small. 14 certified nurse midwives are directly employed by a hospital. They're working under supervision of a physician currently, and if this bill becomes law, they can choose to keep that in place, or they can transition to independent practice or practice within a medical group or nursing corporation. Mr. Chair, I appreciate the work that you and your staff have done on this bill. I really do, and I mean that very sincerely. And the debates that many of you and I have had over the last week over the corporate practice of medicine, its merits and its effects on this bill. However, I hope we will also appreciate the work that certified nurse midwives have put in over the last year to craft language that holds true to the essential role of nurse midwives in our healthcare delivery and the lengths that we've gone to in order to address every stakeholder's concerns. I'm happy to accept the technical amendments noted in the analysis. Amendments B through D, however, on page 15 and 16 of the bill, the terms likely and significant should remain in place as discussed with your staff. As for the broader exemption to the corporate practice of medicine ban, it's worth noting that exempting nonprofit clinics and hospitals does not budge the opposition and unfortunately adds to it. Right now, only a handful of hospitals in opposition, approximately 4, directly employ a certified nurse midwife. And adding an exemption to cover them hasn't changed their position, which simply underscores the fact that the fight isn't over policy, but it's politics. This bill shouldn't become a hostage in a fight over the corporate practice of medicine, and nurse midwives should not be pushed aside while political heavyweights battle for the upper hand. My goal remains the same as it did in February. Certified nurse midwives should be able to independently provide collaborative care that puts women first, with all the appropriate safeguards that consumers expect. I respectfully request your aye vote.
This is in support.
Peter Kellison on behalf of the California Nurse Midwives Association, the sponsors of the bill. We have been working on this language for quite some time. We've been negotiating with all stakeholders throughout the entire process of the legislation. We appreciate the work that your staff has put into this, other members. The Medical Association, which has removed its opposition to the bill. As the bill was initiated over in the Assembly, we took great steps to try to meet every policy concern that was addressable without watering down the bill. The main tenet of nurse midwifery is collaboration with OBGYNs and in the healthcare system, and we've secured that in the legislation itself without expanding the scope of practice of the certified nurse midwives to ensure that collaboration continues, to ensure that the nurse midwives have access to liability insurance. And we have addressed certain issues related to their prescribing authority that has addressed their issue, certain issues. and we removed the medical opposition to this legislation. In accepting the language on the corporate practice of medicine bar, I think that it's worth a moment to explain the practical matter of certified nurse midwife employment and why it is unique, and why in this matter it will not result in either current nurse midwives facing employment complications, nor will it impact future employment situations. So briefly, nurse midwives in California have been licensed to practice since 1974. At that time, their employment model was essentially through medical groups, where they provided services in hospitals, and I say that they were not employed by hospitals; they provided services in hospitals. The UC system was another setting in which they provided this care. Around 1990, they increasingly began contracting their services with community clinics or free clinics, which are also part of the exemptions of the corporate practice of medicine. Around 2000, they began establishing nursing corporations where they could provide services, again, to these settings and then also to birth centers, which is where today most 95% of certified nurse midwives provide services in hospitals, yet they are not employees of hospitals. They're part of a nursing corporation, they're part of a medical group, they're an independent contractor. That is today. Of note, during the 40 years that certified nurse midwives have been providing services in California, they have actually sought to be employed in hospitals, but were not afforded that opportunity because the medical staff would not amend the hospital bylaws to employ them. So for that reason, while in a way the corporate practice of medicine, it's not what our client, the nurse midwives, is seeking to address in this legislation. They're seeking to address expanded access, they're seeking to address parity, whereas licensed midwives who do not work in hospitals were removed from physician supervision last year. They're simply trying to move legislation that is consistent with many of the principles of increasing capacity to provide quality care, outcomes, and cost savings in the system. I thought it was important for the committee to hear why this one issue has not been problematic to nurse midwives because of the uniqueness of how they are employed or how they work in today's system. So with that, I'll turn it over to our next witness.
Thank you. Next witness in support, please.
Good afternoon. I'm Dr. Chitra Achilles-Swaran, an obstetrician gynecologist in San Francisco. I believe that removing the legal requirement for physician supervision will elevate the status of certified nurse midwives and contribute to better birth outcomes in the state of California. My own relationship with nurse midwives started at a place of, frankly, ignorance. In the traditional medical model, pregnancy and birth are regarded as states of physiological deviance, when anything could go wrong at a moment's notice. In viewing birth through this lens, obstetricians are excellent at implementing last resort options that save women and babies every day. However, over the years, I learned that most women will have completely normal, awe-inspiring births that do not require a heavy hand. I learned that midwives can't function in isolation from obstetricians, but we sure can get in their way. The hierarchy imposed by physician supervision contributes to preventable medical errors, poor communication, and worse patient outcomes. I've had the opportunity to practice alongside midwives at places like UCSF and San Francisco General Hospital. And unsurprisingly, these hospitals have 2 of the lowest C-section rates in our state. At the beginning of a shift, midwives and physicians would review our patients together. It was not uncommon for us to call upon the midwives to attend to our patients if we were busy doing a C-section. If complications arose, midwives never hesitated to initiate a consultation with the physician team. And likewise, midwives were a tremendous source of mentorship as physician trainees guided women through normal deliveries. Passing this bill would allow this kind of collaborative care to flourish on every labor and delivery unit. Midwifery care is recognized by the international community as the standard approach to normal birth. The questions around the safety of midwifery care are misplaced, and what we should be asking is why midwives are not attending the majority of births in California. Thank you.
Thank you very much. Other witnesses in support? Good afternoon.
Good afternoon. My name is B.J. Snell, and I'm a certified nurse midwife working in and out of hospital, nationally accredited and state licensed freestanding birth center. I'm here today representing the California Birth Center Association. Currently, there are 8 state licensed birth centers in California, with others under development. Birth centers are an innovation in the delivery of care to healthy, childbearing women and families. Most pregnancies and births are completely normal physiologic events, and as such do not require medical management, as was talked about by the previous speaker. According to the CDC, there is a savings of $1,163 per birth center birth in California. This is based on the 2013 birth center data alone. There was a savings of $1.6 million in California in 2013. Cesarean sections are costly both financially and for long-term health. Women receiving care at birth centers have an average cesarean section rate of 6%, whereas with traditional care it's 32%. CNMs have had furnishing or prescriptive authority in California since 1991, with the addition of all scheduled drugs in 2002. Practice guidelines describe how medications are used based on the education and scope of practice for certified nurse midwives. The Board of Registered Nursing provides oversight for the furnishing authority, and CNMs have demonstrated high patient safety. Ability to furnish and prescribe is within the scope that is delineated within this bill. Medical malpractice insurance is available independent of physician supervision at this time, and at the same level that physicians have. Nurse midwives practice in and own birth centers in California. While there are many physicians that would welcome collaborative practices with certified nurse midwives, they are restricted by their malpractice insurance because of the supervision requirement. This bill will fix that problem. Supervision also restricts appropriate care for patients by requiring a physician to sign requests for medical supplies and medications that are needed for normal care. Removal of supervision language in AB 1306 will permit nurse midwives to order supplies and medications under their own signature. The midwifery model of care is distinct from the practice of medicine and nursing. Removal of physician supervision language will not change the scope of midwifery practice, but it will allow for increased access for women and innovative health systems like freestanding birth centers to develop and thrive, saving the state millions of dollars and improving the health outcomes of women in California by lowering cesarean section rates. Thank you for your time, and I'd be happy to answer any questions.
Thank you, ma'am. Other witnesses in support, and if you have something new to add that has not been shared already, that would be great. If not, if you could be as brief as possible, I'd appreciate it.
Okay, I will be brief. My name is Linda Walsh, and I'm the president of the California Nurse Midwives Association, which is the state affiliate for the National American College of Nurse Midwives. Just to build on what my colleagues have said, I would just like to stress that we do have a very firm structure of rigorous education, rigorous credentialing and national certification, and ongoing mandates for continuing education. And I totally agree that California needs more midwives now. We need to improve access. We know there's a shortage of our OBGYN colleagues, and it's going to get worse as the decades progress, too. So I really would hope that you would consider voting aye for this.
Thank you very much. Others in support?
Thank you, Mr. Chair. Juan Thomas, California Medical Association. We aren't in support of the bill, but we did start out with an opposed unless amended position. I wanted to thank the author and the sponsors for all the tough work and hard work we did on the negotiations and the stakeholder meetings. We asked for a few basic principles that should be in the bill. The bill contains all those basic principles, and as a result, CMA is neutral on the bill. Thanks.
Thank you.
Amber King with the Association of California Healthcare Districts. With the amendments that were taken on July 1st, we will be removing our opposition. Thank you.
Is that opposition and not support? Is that neutral? Neutral. Thank you.
Hi, I'm Jennifer Simoes with the Medical Board of California. The board previously had an opposed unless amended position on this bill. The amendments appear to address the board's concerns. We just have to take it back to our board at our upcoming meeting for a formal position. Thank you.
Thank you.
Roberta Frank, certified nurse midwife, founder of Best Start Birth Center in San Diego, California, urging support. Thank you.
Thank you for coming today. Others in support? Good afternoon.
Good afternoon. Kavita Noble from Los Gatos area, certified nurse midwife in the home and hospital setting. I urge strong support of AB 1306.
Thank you.
Hello, I'm Jody Komatsis-Duvia, birth and postpartum doula from Santa Cruz, California, and I urge support of AB 1306.
Thank you.
Hi, my name is Gina Ariel. I'm a certified nurse midwife with Kaiser, South Sac, and Sutter Davis Hospital, and I urge your support for all the women who are constantly imploring me that they want a midwife and they don't have access to one.
Thank you.
Tammy Pereira, nurse midwife from Palo Alto Medical Foundation, Santa Cruz, urging support. Thank you.
Eva Wax, certified nurse midwife in Santa Cruz, California, urging your support as well.
Thank you.
My name is Chris Snell. I'm the operations director for Beach Cities Midwifery, both in Corona, Long Beach, and Orange County. I'm urging your support for Assembly Bill 1306. Thank you.
Thank you very much.
Joanne Johansson, certified nurse midwife from Palo Alto Medical Foundation, Santa Cruz. Please support this important bill. Thank you.
Thank you.
I'm Amy Nesting, a certified nurse midwife student at Sutter Davis, which has a great collaborative practice with students or with physicians and midwives, and owner of a local lactation practice, and collaborating with the local physician group as well, urging you to support this bill.
Thank you. Yes, sir.
My name is Jonathan Bartlett. I'm a California marriage and family therapist practicing in Los Gatos, and I urge you to pass this bill.
Thank you for coming today. I appreciate it. Anyone else in support? See no one. Those in opposition, please come forward. And perhaps we could make some room at the table.
You can come back when I'm done.
Thank you.
Good afternoon, Mr. Chair and members. Connie Delgado with the California Hospital Association. Excuse me. Here in opposition, I wanted to state first that we do support the full practice authority for many of these healthcare professionals. We've worked with several other members of this committee on other pieces of legislation. However, the amendments that were taken on May 28th to insert the corporate practice of medicine and apply those provisions, that ban, to other healthcare professionals is very problematic for our hospital members. That ban creates an additional layer of obstacles that we see for providing healthcare services to those communities, rural, low-income, communities of color, where getting healthcare professionals are problematic, where having physicians in those communities is already a challenge. So to place an additional layer of burden and not allow for hospitals to employ these professionals really creates a problem. This bill does expand and removes the physician oversight requirement, and thus creates the opportunity for these practitioners to work in our facilities. But with the corporate practice of language in the bill, that does create a very big problem. And for us, we're not able to support this bill today. And I have an additional person here to answer any technical questions you may have.
Very good. Thank you. Others in opposition?
David Ford on behalf of Adventist Health and Loma Linda University Health, oppose unless amended on the bill. The amendment, of course, being to remove the corporate practice ban. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Christy Weiss on behalf of the California Association for Nurse Practitioners. And we very much regret that we're here today with an oppose unless amended position. While we very much support the author and believe that certified nurse midwives should be able to work without physician supervision, as we think nurse practitioners should be able to as well, we believe that the corporate practice ban language sets a very negative precedent for all advanced practice registered nurses, of which nurse midwives and nurse practitioners are in that category. So today we have an oppose unless amended position and would ask that that language come out of the bill. Thank you.
Thank you. Others in opposition?
Thank you, Mr. Chair and members. Mandy Lee on behalf of Sutter Health, also oppose unless amended for the reasons stated by my colleagues previously. Thank you.
Thank you very much. Others, anyone else in opposition to the bill? Seeing no one, we will bring it back to the committee for questions. Comments first? Yes, Senator Mendoza.
I just wanted to get some clarification, Senator Member Burke. I know that we had talked a little bit last week and a little bit today. It's been brought to my attention that there is some concern that some folks are not going to have any kind of access to health in the Central Valley or rural areas, because with this particular ban on I guess on hospitals being able to hire midwives, that we talked a little bit about it. Can you share?
Absolutely.
You said that really won't happen, and can you explain that to me so I can feel more comfortable about voting for your bill?
Yes, and Mr. Chair. I appreciate the question, and I really do appreciate the opportunity to make sure this is very clear. As it stands right now, there are districts, there are 23 counties in California that have less than 2 OBGYNs per every 10,000 women. There are 9 counties that don't have an OBGYN at all. Once we lift the supervision, certified nurse midwives will have the opportunity to go practice there. The way that the bill is written currently, and also let me also make sure that I'm clear, hospital bylaws still will require, a lot of them still require that, will still continue to require that certified nurse midwives practice under supervision. This does not take away from their ability to do that. So the reality is even if this corporate practice ban was removed from this bill, the hospital bylaws would still be in place in which they would continue to have to work under supervision. What this allows them to do is open their own practices without supervision in those same communities so that those women can have access to health care. So this greatly increases minorities in urban areas and rural areas the opportunity to have, for those women who right now clearly are sorely lacking the opportunity to have access to quality health care.
Thank you.
Does that answer your question?
Yeah, that helps. Thank you.
Did you want to respond?
Well, yes. I think when you allow these additional practitioners to open up their own nursing program, nursing corporation, they'll have to provide for liability insurance and benefits for themselves and anybody else who works and do billing. They're going to set up an entire structure, a corporation, to do the very function that they could do as an employee. Those costs of doing that business will be passed on to those hospitals, and therefore may make that a problem for whether or not it would be an efficient way to provide services in those communities.
Okay, thank you. Senator Block, and then Senator Jackson.
Yeah, thank you, Mr. Chair. I apologize. I was in another meeting and got here late, but I very much support the idea of greater scope and more independence for nurse midwives and particularly for more access, greater access. I am concerned about the corporate bar issue, and just because I missed it, I wondered, did the author accept the chair's amendments?
No. And to answer your question, and also to have, I'll let you have an opportunity to do the same. No, with this particular bill, we did not accept the amendment, but I did want to make sure that it was clear that the number that we got from the Hospital Association is that's 14 certified nurse midwives that ban would actually affect, and those can maintain their supervision and stay employed at those hospitals and maintain their and stay under supervision. So they will not lose their jobs. They will actually be able to maintain their current employment. Those 14 women that this actually does affect. And if you want us to answer the question about this.
No, thank you, Senator Block. Senator Jackson.
Yeah,
and
thank you
then
very
Senator
much.
Galgiani and Senator Berryhill.
I'm just reminded that yesterday we celebrated my daughter's 31st birthday, and she was born with the assistance of a nurse midwife. I'd forgotten because it's been so long. But I think that the nurse midwifery is an enormously important profession, and I have nothing but the highest respect and regard for it. I see this corporate practice of medicine to be kind of not a red herring because it's in the bill, but I think this is another discussion. And I think, to be honest, I think we all really need to have that discussion. But I think we need to have it in its own context.
Thank you.
So I'm going to support this bill because I'm going to take that very important issue and put it over here and focus on what I think this bill really talks about. And that is to allow nurse midwifery to be given the opportunity to provide services to people who otherwise wouldn't have them. If it means that there's going to be an additional cost, isn't that what commerce and business is all about? They're going to have to figure this out. But to suppress it because there's another issue out here that's very different, maybe arguably bigger than this issue, or simply, I guess, the safest way to describe it is different than this issue, and needs to be discussed. I don't think there's any doubt about that. But to put it in this bill and talk about it in the terms of nurse midwifery, you know, on behalf of my daughter and myself, and I think a lot of women in today's world who benefit greatly by midwifery, I'm going to move your bill, and I'd like to urge that we have that other conversation in a very different context. I don't think it belongs in this bill. You mentioned 14. I mean, it's de minimis, and but it's a discussion worth having, but not in this bill. So I move the bill.
Senator Galgiani, and then Senator Berryhill and Senator Hernandez.
So as I'm understanding, is the 14 midwives that are currently employed in hospitals, are they grandfathered into the bill so that they can continue practicing?
Is that the complete question? Sorry. Yes. They're not actually grandfathered. The way we actually structure the bill is that at any time, if a certified nurse midwife wants to be employed by a hospital, they just have to maintain their supervision to be employed. And a lot of that is because of these hospital kind of bylaw situations. That's the reality of the way that they work. But I would let a certified nurse midwife actually answer that.
I don't think that this bill will change dramatically. Like I said, there are only 14 that we know of that are impacted. And I think the ability for them to be able to either do as the Assembly member said and continue to practice in the current situation that they are in and therefore not be independent versus be able to structure their business so that they can be independent, which is not a difficult task. I am an independent organization. I'm a nursing corporation and do practice collaboratively with the physicians that I work with.